Ladies and gentlemen, distinguished guests, I'd like to thank Dr. Gador for the invitation to come and talk to you today about postgraduate opportunities in Sheffield. I should just say that a microbiologist, incidentally, is someone who studies small things rather than a very small biologist. So what I'm going to do is I'm going to really describe to you a fairly traditional route whereby postgraduate medical students or dental students can get some additional clinical training, and then show you a new route which we're trying to develop, which tries to bring together a research training but without de-skilling the student at the same time, which is obviously a potential challenge. So what I'm going to do is I'm just going to orientate you for those who don't know where Sheffield is. I'm going to tell you a little bit about the university, but only a few words, and similarly about my faculty, and then go on to talk about these postgraduate opportunities. So where is Sheffield? It's at the heart of the country, as you can see there. It's about 2 hours from London, an hour from Manchester, so it's well sourced by transport links, and it's got the reputation of being the greenest city in the UK, and also is considered to be one of the safest, which is an issue for, of course, some students. The original part of the university was actually the medical school, and this dates from 1828. It was based in the city centre, and then in the late 1920s, early 1930s, it moved out a little bit into the peripheral areas of the city, and that was the first building that was built, and that's still the heart of the university. We're proud of the university in terms of the fact that it is, in fact, amongst the top 1% of universities in the world in the various rankings. And very recently, it was voted the top university for student experience. And then going along with that, it's regularly voted as having the top students' union. So you can see that together we actually really champion the opportunity to develop and look after our students while they're with us. We have 26,000 students from 125 countries, some of which, of course, are from Libya. And we've had some excellent students from Libya and still do. And it's nice to see around the room that there's a few posters from Libya, Libyan PhD students. Now, studying at Sheffield at postgraduate level can be delivered in a number of different ways. There's the traditional way, which is full-time or part-time on the campus. There are some taught programs, so master's programs, for example, as distance learning, but that does require, and I would stress this, it does require very good internet linkages. So because inevitably, not just getting the material from the internet, but in addition to that, actually using Skype or one of these sorts of ways of actually having tutorials with members of staff. And this is vital for that sort of route to be successful. And it has to be a reliable IT interaction. And then at postgraduate level, research level, I should say, it's possible to do research degrees either in Sheffield, full-time, or alternatively as what we call joint or remote location. So that joint location one is where they spend 12 months with us in Sheffield, not necessarily as one period of time. It can be spread over a few months per year, but they spend the rest of the time in another institution. And then we have another option, which is remote location, which is where we have to be pretty sure that they've got the facilities to do the research in their own institution, but they don't have to spend as much as 12 months with us. They do come for different periods of time. And they have, of course, have to have supervisors in both locations in order to do that. And then we do have a few examples, not many, but a few examples of joint degrees. All of these actually are a Sheffield degree, but we have joint degrees with some institutions as well. So there's a range of different opportunities and possibilities for modes of study that can be explored with anybody. The university comprises 5 different faculties, as you can see here, and the university is broad-ranging in its areas of expertise. I would pick out in particular the Faculty of Engineering here, which, of course, has its roots in the history of steel in the city and is very strong on advanced manufacturing. And most recently, they started to develop a significant strength in energy, particularly in energy storage. And then, of course, at the bottom there, the Faculty of Medicine, Dentistry and Health, which is my own faculty. And that faculty is made up of 5 different schools. There's the dental school, there's human communication sciences, which is essentially speech and language therapy, particularly for people who've had strokes or developmental problems. Health and related research, which is public health, health economics, and that sort of thing, nursing and midwifery, and then medicine itself, which is divided into these 5 different departments. And between all of those departments, we provide 40 different taught master's programs. But interestingly, if you look at this, you would think that all of these are likely to be providing some sort of clinical training. And in actual fact, that's not the case. The majority of the learning at clinical level is undergraduate, and only a little bit of it is at postgraduate level. These are the departments that provide any type of clinical-related courses at postgraduate level. And I'm going to talk about one that's run from the Department of Human Metabolism, which is a new area, and that's what I'm going to spend most time on, and one from neuroscience as examples. But I will just touch on the other 2 to mention what they are. Before I do that, I think it's important that everybody understands the challenges of universities providing postgraduate clinical training. And that's because postgraduate clinical training in the UK is normally provided by the National Health Service. And that mission, the mission of that organisation, is to provide patient care. And therefore, they have to be ensured that the quality of the doctors that are doing the treatment is of the highest standard. So they're training qualified medical staff and dental staff within the system, and they're basically doing this as guided experience within the clinics, supervised, of course, by consultant staff and so on. Universities, on the other hand, provide academic training. And of course, in our case, it's a research-intensive, research-led institution. And so it includes research as a large part of the learning mechanism. We do, of course, provide basic clinical training to undergraduate level in dentistry and medicine and so on. But there's only a few examples of postgraduate. And that's because the linkage between these 2 organisations is actually rather difficult because they have completely different missions. However, I'm going to show you a way in which we might be able to start to bridge that gap. It does, however, require motivated consultants in the health service to become involved in this sort of process and idea. So to start with, I'll just go through a relatively traditional approach to give you one example, and that's from neuroscience here. This is in clinical neurology. It's a relatively new program, but it follows a sort of fairly straightforward line. It's a 1-year program. There's 2 routes of study, a science route and a clinical route. Both have core taught modules. They do the same taught modules. The science route, then the student chooses a clinically related research project, but that might include a lot of work in the laboratory. And the other is a clinical route where actually the student is placed in a clinical team. So it's a way actually of a qualified doctor to get some particular specialist training over a relatively short period of time in one particular specialty here. The clinical route students actually need to have a medical degree, and they must be eligible, therefore, for GMC registration, but they don't have to be registered in order to do it because they're coming as a student onto a program. And they have to have good English language IELTS of 7 because they're going to be interacting with the Sheffield public. Sometimes I wonder whether they need it actually to interact with the Sheffield public, but they do, in order to be able to be understood by both parties. These are the sorts of core modules, which are the standard things you might expect the clinical neurology course to provide, and particular emphasis on neurodegeneration, I think, and that, of course, is an international problem that we're all facing. And the mode of learning are relatively straightforward with lectures and seminars, clinical experience, practical demonstrations, and student-led work. So this is a fairly traditional model, of course, but it also incorporates some exposure to the clinics at postgraduate level. Other clinical training opportunities in the faculty include Master of Medical Science in Clinical Communication Skills, and this leads to a professional qualification in speech and language therapy. A doctorate in clinical dentistry, which is a 3-year program. It's a taught program, and it includes specialization in one of 3 different dental specialties, which is endodontics, periodontics, or prosthodontics. They do a research project as part of that, rather similar to a master's, but they get a lot of clinical time during that 3 years. So they do actually follow effectively the curriculum that the specialty training is required to do in order to get registration. They don't actually go for GDC registration at the end of it, but they follow a curriculum that would give them that sort of training. And then there's the new model, which I referred to, which we're trying to develop at the moment. It has effectively been produced. It's going through the university machinery at the moment. It's already got GMC approval and Royal College approval. So I'm expecting that we will have this on the books in the very near future. And this is a professional doctorate in a specialist clinical specialty. And what we're going to start off with is one specialty, which is dermatology. And as I said before, one of the challenges always is to have a consultant or group of consultants who are very enthusiastic about trying to provide a particular type of clinical training. And this is different from the other professional doctorate I mentioned in dentistry, which is a taught program. This one is actually a research program with clinical training. So that's the big difference. So this is an MD with dermatology residency program that follows it. It's laid out essentially like this. Students enter the program by having a master's. And actually the requirement in this case is a master's from one of these 3 institutions in the UK that provide an MSc in dermatology. If we were to open it up to other clinical specialties, that wouldn't necessarily be the case, but we might need nonetheless an MSc in another clinical specialty. So the big parts that starts really in years 2 and 3 on that slide, which is the clinical MD in dermatology. And when I say clinical MD, it is very clinically orientated, but it is nonetheless a research-based degree. And that's a 2-year program in the university. And then if they pass that satisfactorily, which I'll come back to in a moment, they then are allowed to enter into the clinical training residency part of the program, which is 3 years. And that will be done under the auspices of the university, but will take place in the affiliated hospitals to us. So the transition from the MD to the residency program depends upon, first of all, the student doing the research degree, writing of the thesis, and having that thesis examined. If they're considered to be suitable to move forward into the residency program, they're not awarded that MD at that point. What they do, they enter into another part which gives them the Doctorate of Specialist Dermatology qualification at the end. Okay, so it's held, the MD is like the entry requirement. If, on the other hand, they're not deemed to be suitable to enter that residency clinical training, they leave with an MD, so they get something from it. And that MD does include clinical training. So here at the bottom, the MD component is 3 days a week in clinical dermatology research. So they're doing a research project, and that is very often based on the clinics, collecting data, entering patients into clinical trials, and so on. And then 2 days a week is involved with straightforward clinical work, clerking, examining, and treatment planning. The residency program, so once they get through the MD, and as you see that there's quite a bit of clinical work in that MD, then they're allowed to enter this program if they've satisfied. And it is aimed at overseas students to get this additional clinical specialty training. So the residencies, as they go through that part of the training, are evaluated on the basis of a portfolio of clinical cases that they write up as they go, and that then ultimately is examined by an external examiner at the end of the program. And at the end of the program, they sit the specialty certificate examination in dermatology, which is run by the Royal College of Physicians. The residents then, in terms of experience, will get the clinical experience in the affiliated hospitals to the university. They will examine and treat patients under direct supervision by a consultant, and therefore get the one-to-one teaching experience from that. And they will take part in the conventional training of ward rounds and emergency admissions and so on. And they go through a rotation. The rotation includes the subspecialties within dermatology, laid out in a sort of time frame, something similar to this, for 2 years, and then in the final year, they choose a subspecialty within that list, and that will be their particular specialty that they will be an expert in at the end of that final year. Entry requirements into this part of the program is, first of all, a medical degree from a recognized international medical school, from the international directory, and I believe there are 10 in Libya at the moment that are on that directory. An MSc, in this case in dermatology, from a recognized UK university, and then a clinical MD, which is the one I've just described to you. And then assuming that they get through that, they are considered to be equivalent to a specialist senior registrar and therefore registrable with the GMC. Possession, though, as I said before, of the MD is not necessarily guarantee a place on that residency program, because their clinical skills and abilities will be judged during that MD part for entry. And the GMC particularly liked that because that ensured that we were basically getting the best people to move forwards into this training program. And of course, in order to enter that residency program, they do need to be GMC registered, which they do because they've got the clinical MD, and that will give them that recognition for entry into that. Now, in the future, we have got members of staff in the institution who are quite interested in this approach, and they have suggested that we might be able to develop opportunities in respiratory disease, plastic surgery, and orthopedics in a similar sort of way, but obviously they wouldn't have an MSc in dermatology in order to enter this. They would have a different qualification. Okay, so I thought that this might be of particular interest to show a way in which the university can start to get involved in clinical higher specialty training. But other than that, it's very much, as Fintan described earlier on, it's in the health service with sponsorship by appropriate clinicians or college bodies. Thank you very much for your attention.
Thank you.